I'm Patrick Johnson, and I'm pleased to have the opportunity to share our research recently published in the Journal of the American College of Surgery evaluating fenestrating versus reconstituting technique for subtotal cholecystectomy. Subtotal cholecystectomy has been established as a safe bailout method for difficult gallbladders. However, there is no consensus on whether fenestrating or reconstituting is the preferred technique, and our current evidence is significantly limited in understanding surgeon utilization of each technique, as well as the subsequent outcomes achieved. To evaluate these knowledge gaps, we performed a multi-center prospective study, and we had three key findings. First, there is no consensus in the preferred technique for subtotal cholecystectomy. Fenestrating technique was used overall more commonly. However, there was wide variation between hospitals in how each technique was utilized. Second, we found unique complication profiles for each procedure. Fenestrating was associated with a higher rate of bile leak. However, reconstituting was associated with a significantly higher rate of retained common bile duct stones. Finally, we found important differences in the utilization of ERCP after subtotal cholecystectomy. We found that fenestrating was associated with a higher overall incidence of getting an ERCP. However, regardless of technique used, we found that the majority of ERCPs were being performed immediately post-operatively, almost routinely after this type of surgery. So in conclusion, we found that there is no consensus on the preferred technique for subtotal cholecystectomy. We also found unique complication profiles associated with each technique. And finally, we found that the frequent early use of ERCP after subtotal cholecystectomy suggests there may be controversy surrounding whether ERCP should be used routinely or selectively after this procedure. Thank you very much for listening, and if you're interested in learning more, you can find our manuscript in the link in the video. Thank you very much.